I use kind of the framework of PTSD or trauma work. Look, I'm not saying everybody has that, but if you're in a room of 500 people and you say, who has trauma, a few hands go up. I mean, if you're in an informed group or a group of clinicians, might be a lot more. But in that same room, if you say who has stress or has experienced stress in their lives, everybody's hand is going to go up. They've experienced it. We experience stress all the time. And, understanding that, when we can identify what these stressors are and mitigate them or find ways to lessen them, and that's often through activating things through the body, like mindfulness, movement, other forms of experiential therapies that, there's different ones that work for different people, but to kind of settle that stress. When we settle that stress, then we can deal with what the presenting problem is a lot easier. So if I did have depression, it becomes easier to deal with. If I have depression plus all this stress, it becomes harder to deal with. And I think when we look at, people's instinctual responses to life, which are their automatic kind of unconscious responses, anytime we're doing that, it's really a survival-based response. And that comes from, I believe, what is one of our chief problems is that we confuse discomfort with threat. And then we react to discomfort as if it's threat.